Hi, this is Matthew Goodwin, board certified plastic surgeon with Inspire Cosmetic Surgery. Today I'm going to talk about rejuvenation of the neck and the area underneath the jaw. It's very common for some of us to have excess fat, excess skin, or laxity of skin in this area, and we all like to have it nicely improved. There's a few options for this area, and it kind of depends on what your findings are as what is the most appropriate treatment. If you just have excess fat, kind of as this picture, as this cartoon shows, there's a few options. There's a minimally invasive option with an injectable called Kybella. The Kybella is made of deoxynucleic acid, and basically after a series of treatments between 4 and 6 weeks apart. So the Kybella is injected just below the skin into the fat. Your body absorbs the fat over a period of weeks, and then you come in for another treatment. It really depends on how much fat is there and how much of a result the patient wants to determine how many treatments the patient needs. Usually it's 4 to 6 treatments to get an adequate result. Sometimes you can be a little more aggressive and have one treatment with just liposuction. Usually that involves having a small incision just below the chin and then just anterior to the ear on both sides, and you have removal of the fat in each of these areas after injection of a local tumescent. The tumescent is a solution we inject with lidocaine to decrease pain and epinephrine to decrease bleeding. This can be done either awake, either on sedation or asleep, and this would be determined at the time of consultation. Sometimes the problem is that there's too much skin or loose skin, and there are a few energy devices that can be placed below the skin that can help tighten up that area. These include J-plasma by Renuvion or Thermi, which is another radio frequency device. However, sometimes the most tried and true technique is a neck lift, which actually involves tightening and removal of some skin and tightening the underlying muscle called the platysma. That usually involves excision of some skin just below the level of the ear and posterior, extending into the hairline.